Migraine treatment success secret number 7, anemias. I've mentioned that the number one cause of migraines is an autoimmune condition, but the question I get is, what if the patient isn't autoimmune? Since there are a small percentage of patients that are not autoimmune, what else could be causing the problem? Anemia is the answer. Anemia in and of itself is a deal breaker for nutritional support of any kind, including thyroid support, since anemia literally starves your body of oxygen. Oxygen is very important in healing your body. Your brain and nervous system needs two things to survive: fuel and activation. Fuel comes in the form of oxygen and glucose. We're going to talk about glucose in the future secret, but when you're depriving your body of oxygen, you're depriving your red blood cells of oxygen, which is the basic function that maintain and regenerate and heal the body. And the body simply cannot operate adequately if there's no oxygen for the red blood cells. It is vital that the clinician address the anemic patient. Anemia can be due to a variety of reasons and factors, including pernicious anemia, which is an autoimmune disease, or B12 anemia. Some forms of anemia don't seem to respond to iron supplements because the red blood cells break down. So when this happens, supplementing won't increase iron levels and can in fact make the problem much worse. Too much iron in the body is much more toxic than mercury, lead, or other heavy metals. As I've said and will continue to say, if the patient does not have an autoimmune condition but suffers from a chronic condition such as migraines, you want to look at 4 priorities. And the 4 priorities are: number 1, anemia; number 2, blood sugar or glucose; number 3, gut function and liver; and number 4, fatty acid metabolism. All of these systems need to be checked. Don't suffer another minute. Call our office at 336-229-4226 and schedule 2 free visits with Dr. Naylor. Call now. Space is limited.